Welcome to the Chief Healthcare Officer podcast. Today, we're diving deep into workplace challenges in healthcare with a distinguished guest, Isabel Berwick. Isabel is the Working It editor at the Financial Times and the author of The Future-Proof Career. I read her book and I recommend her book to you. Please read this book. You will find amazing insights about the workplace and how to have a future-proof career for yourself. With over 2 decades of experience covering leadership, management, and work culture, she's an expert on navigating workplace dynamics in evolving industries. Healthcare professionals today face unique challenges, from constant policy changes to highly emotional pressure and career demands. In this episode, we will unpack these issues and discuss ways to foster resilience, career growth, and well-being in the workplace. Isabel, welcome to the podcast.
Thank you, Dr. Fatih. It's wonderful to be here.
Just before we start, Isabel, would you like to introduce yourself?
Sure. So I'm Isabel Berwick. I live in London. I've worked for the FD for more than 20 years, doing lots of different jobs. But for the last few years, I've been doing workplace management, leadership, and just the future of work, the way things are changing and how we can navigate that. So I make podcasts, I make videos, I write a newsletter, and I do lots of events. I have a wonderful time and it's great to be here.
Pleasure having you here. Let's get started. Healthcare professionals often face rapid changes in policies, procedures, and even their job roles. How can they best adapt to this uncertainty?
So I think healthcare is perhaps unique in the stresses that professionals face because they're constant and also reactive. It's quite hard to plan, for example, and crisis is almost a constant. So I guess you have to reframe it and see change and disruption as an opportunity. And also, think about how you can work in teams more effectively, create space for yourself. I think more than perhaps in any other sector, workers in healthcare probably struggle to find a little bit of space to think, either short term or medium term, just so that you've got a little bit of a handle on the uncertainty and just can take back a little bit of control. And I'd be interested to hear your views on how to do that.
Well, as a physician and an healthcare leader, every day we have another challenge in the operation. Definitely, it is an amazing opportunity one side. That's why we have selected this profession. But on the other hand, it requires lots of adaptation on a daily basis. That's something we learn every day. But definitely to overcome this, we always believe that, we have to work with our teams and then we have to manage the things together with our teams. So then to manage these teams and then to make resilient, you covered lots of subjects with your guests and then you were teaching us the resilience. So what kind of resilience do you think would be advised to the healthcare professionals with this kind of teamwork?
So I think it's really important to be clear in how you communicate. So much tension and difficulty in workplaces is when people don't communicate effectively. Even when it's a really difficult or perhaps uncomfortable conversation, resilience comes from handling these difficulties in our lives and work and getting through them and perhaps learning. And I think there's a personal resilience, but actually we also have to think of it in a team and also organizational way. We don't operate on our own. So leaders have to be aware of their place within the organization. How far can they affect change and help their teams and themselves become resilient? And how far are they essentially within a bigger organization and don't have power and control? So I guess it's about how we can control what's in our gift control and try not to worry too much about the rest.
And I think this was the point that you covered in your book, The Future-Proof Career. So do you think with this kind of resilient approach, our healthcare professionals can secure their future-proof career?
Definitely. And I think the risk of burnout is high. So resilience is important. And I guess part of that is being in a team where you feel that you're heard and that you can voice concerns, either clinical or management concerns. So yeah, this term psychological safety is used a lot as a kind of buzzword, but in the real meaning of the term is that everyone feels that their voice is heard and that they can speak up about difficult things. It's not about making everybody comfortable. Sometimes we are uncomfortable, but that does help with resilience and with change.
Indeed, indeed. I mean, similar to the UK, wherever we go in the healthcare industry, our teams are under huge pressure. You have patients coming to you every day with another frustration, and you have lots of tasks to complete, documentations, insurance, and then management of the procedures and others. Definitely, I think that's what we want to see from their side. And we want to hear them as the leader. That's what I always try. And I always tell them, please speak up. And when you share your feelings, it will help us to fix them. If they don't share, it will be very difficult to discover their problems. So with this way, I think we can create a safe culture, and then we name it in the healthcare as just culture. And from this point, we can help them more, because things are changing really every single day in healthcare.
I bet. And also, I guess when you're listening to colleagues who might not be as senior as the leader, they may have great ideas that otherwise would be missed.
You said something, the real secret of the healthcare. And that's why we recommend our teams, our leaders to have the rounds, listen to the frontliners, and you can learn from them, and they will share with you amazing feedback. And once you implement that, you'll be the best leader. But then, operation in healthcare is something heavy work, long hours, and we have a buzzword called work-life balance. What do you think about this work-life balance? I mean, do you think we're always in the work and it is difficult to balance it with the life, or life became the work?
I think since the pandemic, it's become a little bit blurred, hasn't it? Because you were probably still going into your workplaces in the healthcare industry during the pandemic, but for many people, you were on Zooms in your home and your colleagues saw your home environment and all became blurred. I think rather than work-life balance, what I'd say is, getting the balance right for you. So for many people like to erect firm boundaries between their work self and their home self. And some people don't mind so much. So I think it's up to you. I guess the thing is to set the kind of, to shut your laptop or to walk away at the end of the day, to have a little, this is a small thing, but it works, to have a small ritual, to have that commute or that car journey or taxi journey, train journey home is a space between your work and your home where you have to transition. And I think just keeping those very small boundaries in place is perhaps the start of better balance.
Indeed. And this was called maybe the me time. And
yeah,
most of my me time I spent listening you. So that's why, we want you to continue your podcast, and then we want to hear more from your side. And I know many people, literally, they were waiting your next episode. So then please, help us to have you in our me times for those rituals.
I'm very honored that you spent your very limited free time listening to the podcast.
Oh, it was a great pleasure, and I want to continue listening you. So then when we look at the burnout, what kind of, you have already covered this in a couple of episodes. What kind of early signs you think we should capture, for our healthcare professionals, and we should be aware of that?
I think it's helpful to define burnout, what we mean by burnout. And correct me if I'm wrong, but the experts I've talked to is it's not just stress, it's total exhaustion. You can't go on. So when you absolutely break down and can't go on, that's burnout. So everything before that is stress. But the warning signs often are things like behavior change. And in a high pressure environment, that behavior change might be around somebody being more irritable than usual, or, panicking when they're not a panicker normally. So I think it's for leaders to really understand how their teams operate in normal times so that they can be alert to the early signs that something is really off with a team member.
No, perfect point. And I mean, in order to also understand that, we have to have a close relationship, right? I mean, if we don't know their regular routine, it will be very difficult to understand some changes in the routine. So that's why we expect from the head of the departments or the physicians to be very close in their work environment with their peers. Then we will be able to understand. Otherwise, it will reach to an explosion level and it will be very difficult to manage. And I totally agree with you. I mean, burnout means something not going in the right way and then not in the routine way. Definitely, I mean, we need to address this and we need to look for a quicker way of mitigating this and helping our team members. So what practical steps do you think healthcare professionals can take to improve their work-life balance?
I do think it's something like just carving a bit of space out for yourself, even if that's just 5 minutes away from your desk. If you can go outside, that's great. If not, just go and sit down with a coffee or, or something and just looking into the distance. So doing nothing for 5 minutes, if that's all you can manage. There's lots of research that our brains really need that rest. So naps are probably not okay for healthcare professionals, but for some workers, a 20-minute nap in the afternoon could be the difference between being able to carry on and not carry on. So I think this stuff is coming, the research is coming all the time. And another thing I really like is replacing a meeting with a walking meeting. Do you have to be sitting in a small room? Could you walk together? Could you have a sit down together and drink something, in the canteen or eat something? So that just moving more meetings into a more kind of connecting situation doesn't make them less professional, but it just gives you a little break and your brain a break too.
Recommendation for the nap is amazing. If we can really find the time for that one, that will be an amazing thing. And then beside that, definitely, I mean, having an in-between short times will be very helpful. But I think as we have just covered the point about the some teamwork and then some close relationship and someone hears you is the most important thing. And we need to create such kind of environments, I believe, to support the work-life balance. Is there anything you would recommend from the other industries, Isabel? You have been covering many other industries, and I would love to hear your recommendation that we can implement within the healthcare.
Yeah, and I think this may be something that happens in healthcare anyway, but it's really important that the leaders set the example of a healthy balance themselves. And I know that for many leaders, they aren't that healthy because they're working so hard. But somebody introduced me to the concept of the healthy workplace, and where you take people's physical and mental health as seriously as you do, the way that they work or the terms and conditions. So the idea that our health is built into the structures of the workplace or concern for our health, I think is something that's really starting to happen in, for example, a lot of consulting firms put a lot of effort into well-being for their staff in terms of making the leaders prioritize, sort of do as I do, do as I do. So leaving to go and see their families, not working excessive hours, that kind of stuff.
I agree. I mean, in healthcare, we're working with huge guests coming to us, and then they come here at any time. And definitely, they all expect some additional efforts from our people. But then the only solution to this, I guess, is the teamwork, and we need to support them. Every single team should go extra mile supporting their peers. And I think with this way, we can have an amazing solution. And with this way, we can also secure the just culture. In healthcare, another important thing, what we see is the diversity. Because today, when we look at the main problem of the healthcare industry, I think it's going to be the shortage of healthcare professionals. In order to address that, the only solution is to get the people, professionals from wherever we can get them. And this also ends up with having people from different schools, people from different cultures, and then fostering this inclusive culture is becoming a critical point in healthcare. Otherwise, we will not be able to manage current loads of work that we have. So how can we foster this culture? I would love to hear your recommendation.
I think those are all great points. And this idea of inclusive recruitment and inclusive leadership is becoming really very important in all sectors. I think in healthcare, you're right, because you serve the whole population. You need to have a diverse workforce so that, you're essentially understanding the population that you serve in the organization. So pulling from all sorts of different areas. I mean, there are lots of different initiatives going on. Things like, working with local colleges or universities on pipelines of new employees, giving people work experience. I think in healthcare, you have the advantage that it's a career that has real purpose and meaning. So you're not having to work to attract people on false pretenses. It is a job where you're giving back, and it has an extraordinary value for the people who work there and for the people who benefit from your care. So it's a good news industry for the people who work there. I think the balance is in showing new recruits that they can have a balanced career and a long-term career, and that they're going to be supported and supportive of other colleagues. And I think the new ideas of inclusive leadership go right back to the things we were talking about at the start around listening to people, whoever they may be. So it's not just the loudest voices in the room that get heard. Early career people will have can be heard as well.
I totally agree. I mean, in my hospital, I have more than 40 nationalities together. I have doctors from UK. I have doctors from Korea. I have doctors from Europe, from the Middle East, from everywhere. And when it comes to the nursing, I have nurses from Indonesia, Nepal, UK, Germany, US, and then all these sort of different nationalities. The thing what we try to do, we try to hold casual meetings, some team meetings together with them, and we just want to hear them, what exactly, their journey is going on. And then we want to understand their issues. And on a monthly basis, we also have created something. We have the country food day. So one month we have the Filipino food, 1 month we have Egyptian food, 1 month we have the German food festival. So with this way, we just want them to feel at home. And with that way, we're trying to create some home environment. Then those people will feel comfortable, and then they can continue. So what do you think? What other practical steps can healthcare leaders to take promoting the diversity and inclusion effectively?
So I think all of those things are brilliant. I guess when you've got a workforce which has many different cultural backgrounds, that's both very exciting, but it can also be challenging. So you have to be, as a leader, you have to be really sure that everyone feels comfortable. And I guess that also means you have to be aware of cultural differences. So, for example, in some cultures, people tend to be more deferential. They may require more coaxing and help to criticize in any way, whether that's a colleague or a leader. Whereas in other cultures, they're very vocal, people are very direct. So I think leaders have to really be across the cultural difference and set the bar high in terms of what's acceptable for our team and our setting. And it's an exciting challenge to have because you've got such an interesting, diverse workforce, but it brings with it some challenges that you have to acknowledge so that everyone feels comfortable.
Indeed. It makes us also very rich. We celebrate Diwali, we celebrate Eid, we celebrate Christmas, there are lots of celebrations. I mean, when you have such inclusive culture around, and then we love it. Definitely, it comes with the challenges because in one culture, maybe you use one word, which is very normal, and the other culture may understand it in a very different way. So you have to be careful in selecting your way from body language to the other languages and everything. And you're very right. I think it ends up at the leader level. And if the leader is ready to absorb all these cultures, it will go very well within the organization. And then patients also, they love it. So when they're in patient room, if they see people from their culture, you can see a much better patient engagement with these patients.
Yeah, that's really good to hear. Yeah, so you can use your staff really in better engagement all round.
Definitely. So let's move to the next chapter, the career advancement without compromising the well-being. Now, well-being is something we always try to mentor our communities, and then we recommend them how to maintain their well-being. And then we just try to explain them how to secure this. And many healthcare professionals, they are ambitious people and want to advance in their careers, but also at the same time, they worry about the impact on their well-being. So Isabel, healthcare professionals often feel pressure to work longer hours, long hours to prove themselves. How can they progress in their careers without risking burnout?
They have to really take care of themselves. And I think that's a lesson that most people have to learn for themselves. I think whatever job we do, we've probably all been young and pushed ourselves harder than we had to in order to be noticed or to get that promotion. But I think as you become more established, you really have to go, it's a marathon, it's not a sprint. And just bearing that in mind. So setting some boundaries around what you'll do when you're not in the office. You may have to answer calls, you may have to go on Zooms, but actually, how do you make up that time elsewhere? Could you, go for a swim, go to the gym, meet up with friends? Try not to let it take up every minute of your day. And I often work at the weekend, but I generally try and protect one day at the weekend so that I don't have to work 7 days. I realize for healthcare professionals, this comes with extra challenges. And I suppose this goes back to the leadership point, which is if the leader is modeling taking breaks and pacing themselves, that will filter down to the team. But if you're working for a leader who is exacting and it seems to be a workaholic, which is a problem in itself, you're going to have a much more difficult time.
You're talking as my mentor, Keith. So, and I try to meet him every weekend, and then we go over the subjects. He was the one managing the Bupa hospitals, and then he was the one who brought the HCA UK to the UK. So then he has been telling me the same thing. He says that, Fatih, look, if you don't take leaves, your people will never take the leaves. So you have to take the leave first. Then your people will follow you taking the leaves. And he says, look, you have to get some breaks. So then your people will also start following you. But in healthcare, sometimes you forget yourself because there are many people around you who are looking at your eyes and that they need, support. And patients, they are around the clock. They want the support all the time. And then whenever they can reach out to you, they want to reach out to you. So, and especially, the next generation. Now we're having the next generation patients who are used to get the answers immediately. And then who are used to order something immediately, anytime, anywhere, whatever they want, to satisfy them. I think even in the healthcare industry, things are becoming more and more demanding.
It's a huge issue, this intergenerational piece, you're right. And I hope that perhaps AI will help a little bit with that. It may be able to do some of the tasks or some of the reassuring that, it's impossible for one clinician to help every patient in that way, in the depth that they may want. So AI may well come to take away some of that administrative load. But I think healthcare has unique challenges around boundaries and balance. That's for sure.
Indeed. AI is something that we have started utilizing it, especially at the documentation part, and it's very helpful. We created a module which helps our physicians in a private mode, complete confidentiality. You can utilize it, and then it helps you to make your documentation better. At least with this way, we can gain some more time and then managing the patients, and also spending more time with our patients instead of just typing. And then we're really trying our best for that. But when it comes back to the well-being and then managing this part, do you think within the organization a mentorship model could help our healthcare professionals to manage their times better?
I think so. I really like mentoring and sponsorship as well as a sort of slightly different model. And so I have people who are informal mentors. I have mentees. I also have someone who's a sponsee now. So I'm a sponsor, which is a little different, and that might work too. So you could have a mentor who is someone you go to directly, who's had more experience. Perhaps they can help you with learning to balance your life and your work if they've been doing it for longer. And then there's a reverse aspect of that. If the mentor and the mentee are quite different in age and outlook, the reverse mentoring aspect, I think, is something that more people are thinking about now. So how can we learn from those who are younger than us? So, for example, people in Gen Z who are probably 27 or 28 at the oldest now have quite a different attitude to work and life, and they want better boundaries. And so perhaps older people can learn something from that. Then they're also pretty good at tech. They can see what's coming around the corner. So I think there are ways in which a mentor-mentee relationship can work, both for our well-being, but also just out of curiosity and interest and learning.
I love your reverse mentoring point. I was just listening your video yesterday, and you touched to the point, and your guest was saying that after a while, most of the employees in the workplace will be over 50s. And then all these over 50s, I guess they want to learn something from those new joiners to the workplace who are more techno-savvy and then more energy, right? And then they can learn from this community. At that time, also the healthcare, I think, will be very busy with this kind of new aging population. And then we need to manage this. So reverse mentoring will be a very important point.
And I think you've touched on something there where when we talk to people who are different from ourselves, it does energize us and open us to new perspectives. But for longevity in the workplace, I think you do need to stay curious about people. I mean, obviously in healthcare, it's all about people. But I think some people, as they get older, get quite fixed in their ways and can be quite jaded. And it's wonderful to be re-energized, to give yourself that extra lease in the workplace. And I think if you can hold on to your curiosity as a leader or as a staff member, it's such a valuable thing.
And curiosity can only happen if you have the right well-being. Otherwise, you will not be able to manage your curiosity, and then you will lose all your interest from all the subjects that we expect you to maintain. So I really appreciate Isabel. I mean, healthcare is a difficult industry, is a demanding area. And then I'm sure healthcare professionals, they really appreciate your recommendations. So I just want to hear from you, the last takeaway from all this discussion, what we had today.
So I've learned a lot from talking to you. And I think the unique challenges of healthcare have to be addressed from the lead, more than anywhere else, actually. The leaders have such a vital role because they have to set the example. People are not going to take breaks, and they can't take care of themselves if they have a workaholic or a difficult boss. So listening to your people and setting the example is so important.
I really appreciate Isabel. And I recommend everyone to follow the Working It. And they should listen to Working It episodes, and they should read the Working It articles. And we will continue to learn from you, Isabel. I really appreciate for your time. Thank you so much.
It's been great. Thanks so much.
You're most welcome. This has been another insightful discussion on workplace dynamics and healthcare. So we have explored how to navigate the change and maintain the work balance and foster the inclusion and grow in our careers while protecting our well-being. So to our listeners, I hope you have found this conversation valuable. If you enjoyed this episode, please subscribe to the Chief Healthcare Officer podcast and share it with your colleagues. Until next time, stay engaged, stay inspired, and continue making a difference in healthcare.